We're going to talk today about acute sinusitis, or as many people know it, sinus infections. Sinus infections, one of the most common complaints during the winter season and a very common reason for unnecessary administration of antibiotics. The sinuses are the hollow areas within the bones of the face that are connected to the nasal openings. These sinuses, these orifices in these hollow areas are lined with mucous membranes, which is tissue that produces mucus, all this junk that we get every time we get a cold. Sinusitis is nothing but the swelling of that lining of those hollow areas and the nose. There are two main types of sinus infections. One that we call acute and the chronic sinus infection. And this is determined based on how long they last. Acute sinusitis is the inflammation that lasts for less than 4 weeks, which is what we most commonly see during the winter season. But what causes a sinus infection? The most common cause of a sinus infection or acute sinusitis is an infection by a virus. And I need you to listen to this very clearly. This is usually associated with a common cold. This is what we know as a viral sinusitis. Sinusitis caused by a bacteria is much less common, and it is important that you remember this because it usually happens only in 0.5 to 2% of the cases, usually as a complication of a viral sinusitis. Therefore, when you get a sinus infection, it does not automatically mean that you need antibiotics. Remember, antibiotics are effective only against bacteria and not viruses. Again, antibiotics are not effective against viruses. Actually, using antibiotics unnecessarily can put you at risk for medication side effects and particularly for the development of an antibiotic resistance. That means the antibiotics don't work against certain bacteria by taking them for sinus infections that are not caused by viruses. Most adults with a normal immune system can also clear even bacterial infections without antibiotics. What do you normally experience when you are having a sinus infection? Well, we've been there before. Thick yellow to green mucus from the nose. By the way, that green color does not necessarily mean this is a bacterial or viral infection. You can have that with either one. We can have nasal congestion, we can have pain or pressure on the face. Other acute sinus infection symptoms can include even fever, which is temperature greater than 100.4 Fahrenheit degrees, feeling tired, cough, difficulty or having inability to smell, ear pressure or fullness, and that is because we have all this congestion up here, headache, and even bad breath. These symptoms usually develop over the course of 1 day and begin to improve by 7 to 10 days. Is there any way that we can know whether we have a viral or bacterial sinusitis? Remember that statistically we know that viral sinusitis is more common, but initially, it could be difficult to know if you have a viral or bacterial infection. Many studies show that how long your symptoms last cannot always be used to distinguish between viral and bacterial sinusitis, but it usually is helpful. For example, if symptoms of sinus infections last more than 10 days, or if you have symptoms that initially improve but then worse again within the first 7 days, you may have a bacterial sinus infection or a bacterial sinusitis, which means you might need at the time an antibiotic to help you improve the symptoms. Do you always have to go to the doctor, or when do you need to be examined? Well, if you have one or more of the following symptoms, you should be seen in person. Persistent high fever, and high fever is defined as a temperature over 102 degrees. Sudden, severe pain in the face or on the head, double vision or difficulty seeing. And that might be because the sinuses located in this area are so inflamed that are causing problems already in your eyes. Confusion or difficulty thinking clearly should actually make you seek medical attention. And that is because the infection could have become really severe and very likely of bacterial nature. Swelling or redness around one or both eyes. Stiff neck as well could be of concern. You may also want to see your doctor if you have symptoms that have lasted more than 10 days, which means you can actually manage your initial viral sinus infection at home. Also, you need to be seen if your symptoms initially get better and then worsen again. How do we treat a sinus infections? Well, really, the basis of the treatment for sinusitis is the relief of the symptoms. Remember that antibiotics are only necessary for a very, and I mean it, very small percentage of people. You should speak with your doctor about whether or not you need antibiotics. Don't simply expect those antibiotics, as the vast majority of the sinus infections often get better without them. Treating the symptoms of a sinus infection is done to relieve symptoms of discomfort and congestion. But you have to remember that managing those symptoms doesn't necessarily mean that the virus is going to go away any faster. But instead, it will give you, those interventions will give you some relief while your body takes care of the infection, which is what happens with every virus. Non-prescription pain medications such as acetaminophen or ibuprofen are recommended for the pain. Nasal irrigation, which is flushing the nose and sinuses with a saline solution, which is a mixture of water and salt several times per day, can help decrease the pain associated with that congestion and shorten the duration of the symptoms. Some people use some devices like a neti pot for this. The use of nasal steroids. Nasal steroids are medications that reduce the inflammation localized in the nose. These are delivered using a nasal spray. They can help reduce the swelling inside the nose, usually within 2 or 3 days. Sprays like Flonase or Nasonex can be obtained without prescription nowadays. The use of nasal decongestants or oral decongestants, medications like Sudafed or Afrin, may be helpful if you have associated symptoms of ear pain or fullness, because they open up all this area in your face and reduce that sensation. Also, the use of medications to thin the secretions, all that junk and mucus like guaifencin or mucinex, may help you to clear the mucus. Breathing in warm, moist air or steam may temporarily relieve the congestion. But really, there is no evidence that it will shorten the duration or severity of the symptoms. Remember that this is a viral infection, so basically we have to run it. We have to let it run its course. If you need to take antibiotics, one of the least expensive and most effective antibiotics for sinusitis or sinus infection is amoxicillin, and many of you have probably used it. There are other antibiotics that can be used if there's an allergy. Regardless of which antibiotic is prescribed, it is important to follow the dosing instructions carefully and absolutely to finish the entire course of the treatment. In some cases, symptoms of sinusitis improve but then come back. This might be because the infection was either not completely eliminated by the antibiotic because you didn't finish the treatment, or because the bacteria was resistant to that antibiotic. Therefore, you might need a different antibiotic or an extended antibiotic treatment. Just follow up with your doctor. So here are the 5 things for you to remember about sinus infections. 1. A sinus infection is the inflammation of the hollow areas of the bones of the face. 2. The majority of sinus infections are caused by viruses. 3. Antibiotics are not always necessary. 4. Treatment is mostly to control the symptoms. And finally, many over-the-counter medications can be used for the management of those annoying symptoms.